If some members of the team feel discouraged from making their voices heard or sense that they are on the outside looking in, we are not only robbed of their insights and contributions, but empirical data says that they are far more likely to leave. This results in the expensive and time-intensive process of recruiting, hiring, and training new employees, who in turn may also be prone to leave if biases aren't addressed and corrected. Perhaps most worrying is the wealth of evidence that suggests that implicit or unconscious bias can have a real and life-altering effect on the level of care that a patient receives. One study examining racial differences in medical treatment used actors to portray patients with chest pain. In each portrayal, the socioeconomic status, type of insurance, and severity and type of disease remained the same. The only variations were sex and race. The study results indicated that healthcare professionals were less likely to refer women and black patients for cardiac catheterization than they were white male patients, a decision that could impact the health, the mortality and morbidity among minority patients. That is one reason why stepping up to the challenge of implicit bias is so important. Oftentimes, our biases turn up in subtle ways, a desire to include people who are like us and to exclude those who are not. In a diverse, fast-paced workplace such as UAB, this manifests itself in the notion of fit. The idea that a particular student or employee just doesn't fit in with the overall culture. In fact, psychologists have identified 18 different types of cognitive bias that impact how we see the world, which influences how we make decisions. Here are just a few examples. Confirmation bias, focusing only on information that confirms what you already believe to be true. All people have a tendency to seek out evidence to support their assumptions about people, situations, and opinions. This tendency means we only see evidence that supports what we already think. Blind spot bias, viewing oneself as less biased than others. Manifestations of bias. Now that we have a better idea of what bias is, let's take a look at some specific examples of how it manifests in certain groups. While I find some individuals I work with to be open to others' opinions, I think some people are quick to discount perspectives that differ from their own. Sex bias can manifest itself in a variety of subtle and not so subtle ways. For example, the presumption that women are less competent than men. A science faculty recently used a double-blind study to rate student applications for a laboratory position. In the study, all applications were randomly assigned male and female names. The faculty rated the male applicants as significantly more competent and hireable than the female, selected a higher starting salary, and offered more career mentoring. And this was the case regardless of whether the faculty member performing the ranking was male or female. Both were equally likely to exhibit bias against the female student. Another study, done by submitting applications adjusted for GPA, gender, and major, shows that women benefit from moderate academic achievement but not high academic achievement, whereas men, especially in math-related majors, are called back at a rate of nearly 3-to-1 over their female counterparts. A survey conducted with hiring decision makers reinforces these findings. It suggests that employers value competence and commitment among male applicants, but prefer female applicants who are perceived as likable. Speaking up in a group setting has many recognized benefits. It can improve group performance and creativity, and those who speak the most in groups tend to emerge as leaders. However, 2 research studies in both student and workplace situations confirm the reality that men get leadership credit for voicing ideas, but not for voicing problems. Women do not get credit for speaking up at all. It doesn't increase their perceived status in the group in any positive way. Women who are mothers are doubly disadvantaged. Repeated studies show that mothers earn less than childless women. In fact, the gross motherhood penalty is currently between 5 and 10% per child. Even when controlling for factors such as mothers spending less time in the workplace due to childcare responsibilities or work status, full-time versus part-time, 50% of this wage gap remains unexplained. The flip side is the fatherhood bonus, whereby the pay gap between men and women who are parents is increasing. High-income men get the biggest bonus for having a child, while low-income women pay the biggest price. On average, men's earnings increase by more than 6% when they have children. Then there's the maternal wall. This is a sex bias unique to career-minded women who become mothers. To be clear, motherhood is a key trigger for stereotyping at work. Mothers are 100% less likely to be promoted than non-mothers. Maternal wall sex bias is often not even seen as sex discrimination. Rather, it is masked by a more subtle discriminatory action known as benevolent sexism, whereby a supervisor or employer implicitly believes an individual mother will conform to traditional female patterns. In other words, they assume the mother would naturally choose motherhood over a career. They therefore try to help by passing over mothers for positions of greater responsibility. It's very difficult to be a breastfeeding mother or to have sick children and to continue to work. I don't feel that I have the support I need to make this possible, and I worry that needing to care for my children will damage my career. I was asked to serve on an advisory committee, and I briefly felt honored. Until the committee director said, "We have to have a woman on the committee. Will you do it?"